prevalence rates, I'm quoting the previous census data. So 2011, Government of India at the last census, and it shows that around 3% of the people of our country have a disability, and in that 19% seem to have, they are reported to have hearing disorder, so which is the second most disability. And coming to the speech disorders, it is about 7%. So when I say it in these percentages, it might sound small, but looking at the volume of population of our country, and when we translate it to the absolute numbers, it's a huge number. So certainly we should give more attention for all these communication disorders.
I hope the prevalence is little high now. So can you please explain what are the possible causes of these communication disorders? What are
causes, again, it can be explained very extensively also, but let me briefly talk about it. So causes, I started with difficulty in pronunciation. So all that happens if there is a structural anomaly for the person, like something like a cleft lip and palate, that is, the oral structures are not proper, some malalignment of the teeth. There are so many causes. And coming to the stuttering, it could be running in the families. It's very often seen that more than 50% of the cases with stuttering have a family history, and sometimes it could be genetic. And coming to voice disorders, it is particularly seen in people who use their voice for their profession, or abuse their voice, like shouting, screaming, do not keep their larynx in good health or vocal folds in good health, keep them hydrated. So these are causes which can cause speech disorders. And coming to the language disorders, the first thing is, I said, the hearing impairment, that has a huge list of causes. And about the other causes, to tell you briefly, like there are many causes which happens during the mother's pregnancy and during birth of the child, as well as after the birth of the child. So mothers should not have any infections, the pregnant mother should not be infected, and they should not have any fall or accidents and things like that. And the delivery time also, it should not be a complicated delivery, because sometimes the child can have a lack of oxygen. So, and even the birth cry could be delayed. Birth cry is very important for a baby, newborn baby, because if the birth cry is delayed, it indicates that there is lack of oxygen supply to the brain, and which can result in a brain damage. And the brain should be in good function, for all our functions are depending on the brain activity. So when the child has a brain damage, it directly impacts all the other developments, and that seriously impacts the speech and language and other skills also. And after the child is born also, there could be many conditions like seizures, then neonatal jaundice. So, and even the child should be taken care, so that the child does not fall and have a brain damage. And any other thing that can impact the child's overall well-being can result in a communication disorder. And coming to the adults, as I said from the orientation, that all the such things should be avoided, like a healthy lifestyle always results in good communication also. So anything, even high BP, all that also can cause a brain damage. It can cause a stroke, which can result in a communication disorder. This is just the gist of it. So we can have more elaborate talks on that also.
Since today's program is already, it's about prevention of communication disorder, can I ask you, ma'am, is there any means to prevent this speech and language disorder that can occur?
Yeah, definitely. Prevention is always better than cure, isn't it? We all believe in it. To talk about prevention, in fact, it's especially for children, it begins even before the mother has conceived the baby. Before the pregnancy itself, the mother should be healthy, and she should become pregnant only in the right age group, because before 16 it is too risky, and even a late pregnancy is always said to affect the fetus. And another thing is, the mother should take all precautions to see that she's not having any infections, especially some of the viral infections which can seriously affect the child's internal organs, and these sense organs all developed during the first 3 months of pregnancy. So that is very, very essential that the mother is absolutely free of any infections, and she should not have any excess exposure to all these radiations, drugs, x-rays, and she should take the medication as per the doctor's recommendations, and at the right time. If any vaccination is recommended, that should be taken, and folic acid should be taken to avoid certain conditions, structural anomalies in the babies. And throughout the pregnancy, the mother should have good healthy food, and the child should not be born as a underweight, low birth weight baby or a premature baby. All these are risk factors which can be prevented if proper care is taken. And even during the delivery, it's always advisable to have a hospital delivery so that doctor's attention is there full time. And post delivery also, all the precautions to be taken, like as I said, for the causes, all those preventive conditions to be avoided. So that, and after the birth also, it's not that once a child is born, our role is over. So after the child is born, the parents should closely monitor the milestones of the child, because there are definite milestones at what age the child sits, what age the child starts walking, similarly at what age the child starts speaking. So if you find that your child is different from the other same age, same group of children, you should definitely consult a professional. And for good speech and language development, one emphasis is always good speech stimulation at home. So if there is no stimulation, definitely the child can have and can end up in communication disorders, especially like autism. Just yesterday I was talking to one of my colleagues, and she was saying her sister's child was in the Gulf, one of the Middle East countries, and because of the COVID, they were fully confined to home, and the child had all symptoms of autism. Okay, so all that, even reduced interaction with the child, giving less quality time to the child, can result in communication disorder. So parents should understand all this and take precautions not to do all these things.
Okay, thank you, ma'am. So, ma'am, I want to ask you, like once the communication disorder is diagnosed, what are the treatment options other than what parents can do at home from a professional end? What can be done?
Yeah.
Can you please elaborate?
Yeah, sure. Coming to one more thing I just would like to add about the prevention. Since I come from the Department of Prevention of Communication Disorders, we try to prevent these at 3 levels, that is primary, secondary and tertiary. Primary is we give information to the general public, orient the public about how to identify these conditions as early as possible, or whom to seek help, all such information. At the secondary level, we will be screening the newborn babies and all that. Of course, my colleague will be elaborating more on that. And at the tertiary, it is that we give treatment to who are diagnosed to have such a disorder. So the first mantra is early identification, and if identified early, the treatment should also start immediately. The parent should never delay it, because delay causes a lot of damage to the baby's development, and it is not just the child's life that is affected, it's the whole family's life that is affected. It's a quality of life, everyone involved with the child that's affected. So the first thing everyone should remember is early identification and early rehabilitation. At our institute, when such conditions are identified and they are brought to our institute, we diagnose them in detail and make the suitable referrals. It may not be just the speech language pathologist and audiologist involved. We have a team of professionals that are involved in rehabilitation of such communication disorder population, and the whole team is available at our institute also. I am happy to say that. Okay, so and the treatment, coming to the treatment, it is a long-term treatment many times, because the child or the adult will be recommended speech language therapy. So which is not a, you get a fever and go to a doctor and take an injection and you are relieved of it 1 or 2 days later. But it is not the same thing in communication disorders. You might need the treatment for maybe even starting from a month to almost maybe one or 2 years. So it is, since it's a long-term treatment, the parents have to be very patient, and they have to make the child or the adult concerned have to undergo the speech and language sessions therapy, wherein the specialists advise them what to be done exactly and how to improve their communication skills.
Okay, thank you, ma'am. Madam was explaining hearing loss as one of the major cause of communication disorders also. So in this connection, I would like to ask Dr. Sandeep, sir, can you please explain the prevalence of hearing loss?
Okay, sure. See, when we say prevalence, what we are referring to is the frequency of occurrence of that condition. So when it comes to hearing loss can be due to variety of causes. and we can see hearing loss right from birth till the old age. So, if you take the overall prevalence of hearing loss, let me quote World Health Organization's data. According to them, nearly 430 million, which comes to around 43 crores of the world's population, have got disabling hearing loss. Disabling hearing loss, when we say, they have got significant hearing loss in terms of decibels. If I have to say, it's more than 30 to 40 decibels of hearing loss. Of this, about 9% of them are from the children, the pediatric population. Now, as I said, it's because of the variety of causes. Therefore, prevalence depends on a lot of factors. For example, it depends upon the age. As I said, it's definitely less prevalent in younger group compared to older group. One possible reason is, when we say younger group, pediatric population, we are only talking about age group below 15 years, whereas when we talk of adults, we are talking right from 16 years to 100 years. Other one, gender, there is some difference in the prevalence between the two genders. And also, depending upon the cause of hearing loss, prevalence could vary. Okay, so we need to know that prevalence can vary due to so many factors, and overall prevalence is about if I have to take in pediatric population. I specifically want to stress on pediatric population because that is where the hearing loss actually has a significant impact on the development and the quality of life. For example, if it is acquired hearing loss, they have already developed speech and language abilities. They have already developed the communication skills. So, if we feed them with an amplification device, they are able to hear, and whatever communication abilities they have developed, that continues as it is. Whereas, if it comes in the prelingual age, before they have developed speech and language abilities, what is likely to happen is they are not getting the input from the environment. They are not getting to hear the speech that they are supposed to develop. Therefore, they don't develop speech and language abilities. That is the biggest threat in prelingual hearing loss. If you take the congenital hearing loss as such, it is said that the prevalence is about 1 to 2%, 1 to 2 infants in about 1,000 live births. But that again, the prevalence varies depending upon, we are talking about well baby nurseries, babies who are born in good health condition, or we are talking about babies who are handled in the NICUs, neonatal intensive care units. In the NICU babies, the prevalence is significantly high compared to well baby nurseries. It's about 22 to 25 live births in NICU babies, whereas it was only 1 to 2% in well baby nurseries. Prevalence also increases, prevalence of hearing loss also increases with age group. For example, if you take school age, apart from these prelingual causes of hearing loss, a lot of children with otitis media gets added to this prevalence data. We'll handle this call.
Hello, good afternoon. Hello.
ಹಲೋ
ಹೇಳಿ ಸರ್.
ಸರ್, ನೀವು ಈ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡ್ತೀರಲ್ಲ, ನನಗೆ ಗೊತ್ತಾಯ್ತು.
ಹಾಂ ಸರ್, ಹೇಳಿ ಸರ್.
ಸರ್, ಇದನ್ನು 100% ಕಂಪ್ಲೀಟ್ ಆಗಿ ಡಿಸಾರ್ಡರ್ನ ಪ್ರಿವೆಂಟ್ ಮಾಡೋಕ್ಕಾಗತ್ತಾ ಸರ್?
ಸರ್, ನಾನು ಈ ಕಾಲು ನಮ್ದು ಎಕ್ಸ್ಪರ್ಟಿಗೆ ಹ್ಯಾಂಡ್ ಓವರ್ ಮಾಡ್ತೀನಿ, ಅವ್ರು ಆನ್ಸರ್ ಮಾಡ್ತಾರೆ ನಿಮ್ಮ ಕ್ವೈರಿಗೆ. ಸರ್, ಪ್ಲೀಸ್.
ನಾನು ಡಾಕ್ಟರ್ ಸಂದೀಪ್ ಅಂತ ಮಾತಾಡೋದು. ನಾನು ಮಾತಾಡ್ತಿರೋದು ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಕ್ಲಿಯರ್ ಆಗಿ?
ಹಾಂ ಸರ್ ಕೇಳಿಸ್ತಿದೆ.
ಓಕೆ. ಪ್ರಿವೆನ್ಷನ್ ಅಂತ ಹೇಳಿದಾಗ ಮಲ್ಟಿಪಲ್ ಲೆವೆಲ್ಸ್ ಆಫ್ ಪ್ರಿವೆನ್ಷನ್ ಇದೆ. ಒಂದು ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ನು, ಮತ್ತು ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ನು, ಆಮೇಲೆ ಟೆರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತ. ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತ ಹೇಳಿದ್ರೆ ಆ ಕಂಡೀಷನ್ ಬರದೇ ಇರೋ ಥರ ಮಾಡೋದು. ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂದರೆ ಆ ಕಂಡೀಷನ್ ಬಂದಮೇಲೆ ನಾವು, ಸೆಕೆಂಡ್ರಿ ಮತ್ತು ಟೆರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತ ಹೇಳಿದ್ರೆ ಬೇಸಿಕಲಿ ಆ ಕಂಡೀಷನ್ ಬಂದ್ಬಿಟ್ಟಿದೆ, ಬಂದಮೇಲೆ ಅದನ್ನು ಹೆಂಗೆ ಹ್ಯಾಂಡಲ್ ಮಾಡೋದು, ಅದು ಸೆಕೆಂಡ್ರಿ ಮತ್ತು ಟೆರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. ಅಂದರೆ ಕಂಡೀಷನ್ ಬಂದ ಮೇಲೆ ಆ ಕಂಡೀಷನ್ನು ನಮ್ಮ ಜೀವನನ ಜಾಸ್ತಿ ಇಂಪ್ಯಾಕ್ಟ್ ಮಾಡಬಾರ್ದು. ಅದ್ರ ಬಗ್ಗೆ ನಾವು ಏನು ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ತಗೋಬಹುದು, ಅದು ಏನು ಸ್ಟ್ರಾಟಜೀಸ್ ಮಾಡಬೇಕು, ಅದು ಸೆಕೆಂಡ್ರಿ ಮತ್ತೆ ಟೆರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಲ್ಲಿ ಬರುತ್ತೆ. ಐ ಥಿಂಕ್ ನೀವು ಕೇಳ್ತಿರೋದೇನಂತ ಹೇಳಿದ್ರೆ ಈ ಕಂಡೀಷನ್ ಬರ್ದೇ ಇರೋ ತರ ಮಾಡ್ಬೋದಾ ಅಂತ.
ಹೌದು ಹೌದು ಸರ್, ಕಂಪ್ಲೀಟ್ 100% ಆಗಿ ಸ್ಟಾಪ್ ಮಾಡಬಹುದು ಅಂತ ಕೇಳಿದ್ರು.
ತುಂಬಾ ಒಳ್ಳೆ ಕ್ವಶನ್. ನಾನು ಮತ್ತೆ ವರ್ಲ್ಡ್ ಹೆಲ್ತ್ ಆರ್ಗನೈಸೇಷನ್ ಡೇಟಾನೇ ಕೋಟ್ ಮಾಡ್ತೀನಿ. ಇದು ನಾನು ಆಲ್ರೆಡಿ ಹೇಳ್ದಂಗೆ ತುಂಬಾ ಕಾಸಸ್ ಬೇರೆ ಬೇರೆ ಕಾರಣಗಳಿಂದ ಬರ್ತಾ ಇರುತ್ತೆ. ಈ ಏನ್ ಕಮ್ಯುನಿಕೇಶನ್ ಡಿಸಾರ್ಡರ್ಸ್ ಇದೆ ಅದು. ಸೊ ಅರೌಂಡ್ 50 to 60% ಪ್ರಿವೆಂಟಬಲ್, ಅಂದ್ರೆ ಪ್ರೈಮರಿ ಲೆವೆಲ್ ಅಲ್ಲೇ ಪ್ರಿವೆಂಟಬಲ್. ಇನ್ನ 30 to 40% ಏನಿದೆ ಅದು ನಾಟ್ ಪ್ರಿವೆಂಟಬಲ್. ಸೊ ಹಾಗಾಗಿ ನಮ್ಮ ಪ್ರಿವೆನ್ಷನ್ ಆಫ್ ಕಮ್ಯುನಿಕೇಶನ್ ಡಿಸಾರ್ಡರ್ಸ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಏನಿದೆ, ಆ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಲ್ಲಿ ಒನ್ ಆಫ್ ದ ಪ್ರೈಮರಿ ಕೆಲಸ ನಾವೇನ್ ಮಾಡೋದು ಅಂತ ಹೇಳಿದ್ರೆ, ನಾವು ಪಬ್ಲಿಕ್ ಎಜುಕೇಶನ್ ಬಗ್ಗೆ ತುಂಬಾ ಕೆಲಸ ಮಾಡ್ತೀವಿ. ಸೊ ಜನಗಳಲ್ಲಿ ನಾವು ಕರೆಕ್ಟಾಗಿ ಅರಿವು ಮೂಡಿಸಿ, ಈ ಪ್ರೆಗ್ನೆನ್ಸಿ ಟೈಮಲ್ಲಿ, ಡೆಲಿವರಿ ಟೈಮಲ್ಲಿ ಅಥವಾ ಮಗು ಹುಟ್ಟಿದ ಮೇಲೆ ಏನ್ ಕೇರ್ ತಗೋಬೇಕು ಅದನ್ನ ಕರೆಕ್ಟಾಗಿ ತಗೊಂಡ್ರೆ ಈ ಕಂಡೀಷನ್ ಬರ್ದೇ ಇರೋ ತರ ನಾವು ನೋಡ್ಕೊಳ್ಳೋಕೆ ಖಂಡಿತ ಸಾಧ್ಯ ಇದೆ. ಸೊ ಪಬ್ಲಿಕ್ ಎಜುಕೇಶನ್ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟು. ಹಾಗಾಗಿ ನಮ್ಮ ಸಂಸ್ಥೆ ಇದ್ರ ಬಗ್ಗೆ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ತುಂಬಾ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ. ಪಬ್ಲಿಕ್ ಎಜುಕೇಶನ್ ಬಗ್ಗೆ ಮುಂಚೆಗಿಂತ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಈ ನಡುವೆ ತುಂಬಾ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ. ಸೊ ಈ ಕಂಡೀಷನ್ಸ್ ಬಗ್ಗೆ ತಿಳ್ಕೊಂಡು ಅದು ಹೇಗೆ ಬರ್ದೇ ಇರೋ ತರ ನಾವು ನೋಡ್ಕೋಬೇಕು ಅನ್ನೋದು ಜನಗಳಲ್ಲಿ ಕರೆಕ್ಟ್ ಆಗಿ ಅರಿವು ಮೂಡಿದ್ರೆ ಅರೌಂಡ್ 50 to 60% ಪ್ರಿವೆಂಟ್ ಮಾಡೋಕ್ಕೆ ಖಂಡಿತ ಸಾಧ್ಯ ಇದೆ, ಬಟ್ ನಾಟ್ 100%.
ಸರ್ ಆನ್ಸರ್ ಕ್ಲಿಯರ್ ಇತ್ತು ಅಲ್ಲ ಸರ್? ಕ್ಯಾನ್ ಐ ಕಟ್ ದ ಕಾಲ್? ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ಕಟ್ ಆಗ್ತಿತ್ತು ಸ್ವಲ್ಪ.
ಓಕೆ, ಇನ್ನು ಏನಾದರೂ ಡೀಟೇಲ್ ಇನ್ನು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಬೇಕಾ ಸರ್? ನಿಮಗೆ ಅರ್ಥ ಆಯ್ತಾ ಸರ್?
ಕರೆಕ್ಟಾಗಿ ಗೊತ್ತಾಯ್ತು.
ಓಕೆ,
ಪ್ರೈಮರಿ ಸರಿ ಬಿಡಿ ಸರ್.
ಓಕೆ ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ, ನಾನು ಇದ್ರ ಬಗ್ಗೆ ಪ್ರಿವಿಲೆನ್ಸ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದೆ. ಸೊ ಪ್ರಿವಿಲೆನ್ಸ್ ಬೇರೆ ಬೇರೆ ಥರ ವೇರಿ ಆಗುತ್ತೆ. ಸೊ ವೆಲ್ ಬೇಬಿ ನರ್ಸರಿ ಮತ್ತು ನಾಯ್ಸ್ ಇಂಡ್ಯೂಸ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಅಂತ ತಗೊಂಡಾಗ ಪ್ರಿವಿಲೆನ್ಸ್ ರೇಟ್ ಬೇರೆ ಇರುತ್ತೆ. ಏಜ್ ರಿಲೇಟೆಡ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಅಂತ ತಗೊಂಡಾಗ ಸೊ ದ ಪ್ರಿವಿಲೆನ್ಸ್ ಇಸ್ ಆಬ್ವಿಯಸ್ಲಿ ಗೋಯಿಂಗ್ ಟು ಬಿ ಡಿಫ್ರೆಂಟ್. ಸೊ basically all that you have to know is there is a significant number of individuals in this world who have got disabling hearing loss. That's the tagline.
Okay, sir. Sir, you explained here and there about some of the causes. Can you just elaborate the major causes of hearing loss?
Okay. See, major causes of hearing loss, again, it depends upon what age it is occurring. In pediatric population, the causes of hearing loss are different, whereas in the adult population, the causes of hearing loss are different. Generally, you can classify the causes of hearing loss into 3 categories. One is genetic or hereditary, that is one type. Other one is acquired cause, and the third one is sporadic, where we are not understanding as to why it is not. It's also called as, you can also term it as idiopathic.
Excuse me. Hello, good afternoon.
Good afternoon, sir. ನನ್ನ ಹೆಸರು ವೆಂಕಟೇಶ್.
ಹೇಳಿ ವೆಂಕಟೇಶ್.
ನಾನು ಟೀಚರ್ ಟೀಚರ್ ಅಂದ್ರೆ ಅಲ್ಲಿ
ಓಕೆ,
ಆನ್ಲೈನ್ ಕ್ಲಾಸಸ್ ತಗೋತಾ ಇದ್ದೀನಿ.
ಓಕೆ,
ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ಸ್ವಲ್ಪ ಥ್ರೋಟ್ ಪೇನ್ ಆಗ್ತಾ ಇದೆ, ಮತ್ತೆ ನಾವು ವಾಯ್ಸ್ ಚೇಂಜ್ ಆಗುತ್ತೆ, ಸ್ವಲ್ಪ ಚೇಂಜ್ ಆಗ್ತಿದೆ.
ಓಕೆ ಓಕೆ,
ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ, ಮತ್ತೆ ಏನು ಮಾಡಬೇಕು ಸರ್?
ಸರಿ, ಡಾಕ್ಟರ್ ಶ್ರೀದೇವಿ ಮ್ಯಾಮ್, ಕ್ಯಾನ್ ಯು ಪ್ಲೀಸ್ ಆನ್ಸರ್ ದಟ್ ಕ್ವೈರಿ?
ಶೋರ್. ಹಲೋ.
ಮೇಡಮ್.
ಹಲೋ, ವೆಂಕಟೇಶ್ ಅಲ್ವಾ ಹೆಸರು?
ವಿನಯ್ ಮೇಡಮ್.
ಓ, ವಿನಯ್, ಸಾರಿ. ಓಕೆ. ಸೊ ನೀವು ಟೀಚರ್ ಆಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
ಹೌದು ಮೇಡಮ್.
ಸೊ ಎಷ್ಟು ಅವರ್ಸ್ ಕ್ಲಾಸ್ ತಗೋತೀರಾ ಪ್ರತಿದಿನ?
ಸುಮಾರು 5 to 6 hours ಆಗುತ್ತೆ ಮೇಡಮ್.
ಓಹೋ, ಇಸ್ ಇಟ್ ಕಂಟಿನ್ಯೂಸ್?
ಮೇಡಮ್ ಬ್ರೇಕ್ 11 to 12 ಬ್ರೇಕ್ ಆಗುತ್ತೆ, 3 to 4 ಬ್ರೇಕ್ ಆಗುತ್ತೆ.
ಇನ್ ಬಿಟ್ವೀನ್ 1 hour ಇದೆ, ಬಟ್ ಅಂದರೂ ಕೂಡ ಸಮ್ ಪೀಪಲ್ ಆರ್ ಮೋರ್ ವಲ್ನರಬಲ್ ಫಾರ್ ದೀಸ್ ಕಂಡೀಷನ್ಸ್. ಸೊ ಯು ಆರ್ ಎ ಪ್ರೊಫೆಷನಲ್ ಯೂಸರ್ ಡೆಫಿನೆಟ್ಲಿ, ಬಿಕಾಸ್ ಯು ಆರ್ ಎ ಟೀಚರ್ ಅಲ್ವಾ? ಸೊ ನಿಮ್ಮಲ್ಲಿ ಈ ಥರ ವಾಯ್ಸ್ ಪ್ರಾಬ್ಲಮ್ ಬರೋದು ಸಾಧಾರಣ ಅದು. ಸೊ ಟು ಪ್ರಿವೆಂಟ್ ಎನಿ ಫರ್ದರ್ ಡ್ಯಾಮೇಜ್ ಯು ಶುಡ್, ನೀವು ಮಧ್ಯ ನೀರು ಕುಡಿತೀರಪ್ಪ?
ಕೊಡ್ತೀನಿ ಮೇಡಮ್.
ಮಧ್ಯ ನೀರು ಕುಡಿತೀರಾ, ಬಟ್ ಈಗ ಏನು ನಿಮಗೆ ವಾಯ್ಸಿಗೆ ಬದಲಾವಣೆ ಅನಿಸ್ತಾ ಇದೆಯಾ? ಸ್ವಲ್ಪ ಅನ್ನಿಸ್ತಾ ಇದೆ. ದೆನ್ ಒಂದ್ಸಲ ಈಗಲೇ ತೋರಿಸ್ಬಿಟ್ರೆ ಒಳ್ಳೇದಲ್ವಾ? ಸೊ ವೇರ್ ಡು ಯು ರಿಸೈಡ್? ಯಾವ ಊರಲ್ಲಿದ್ದೀರಾ?
ನಾನು ಹಿಂದೂಪುರ ಮೇಡಮ್, ಅನಂತಪುರಲ್ಲಿ, ಆಂಧ್ರ ಬಾರ್ಡರ್.
Andhra border alli. Okay, okay. So for time being, I don't know whether any speech and hearing clinic is available in your location ಅಂತ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ಬಟ್ ನಿಮಗೆ ನಿಮ್ಮ ಡೌಟ್ ಇರೋದ್ರಿಂದ ಒಂದ್ಸಲ ನೀವು ಇ ಎನ್ ಟಿ ಡಾಕ್ಟರ್ ಹತ್ರ ಏನಾದರೂ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಇದೆಯಾ ಆ ಥರ ಏನಾದರೂ ಸ್ವಲ್ಪ ವಾಯ್ಸ್ ಚೇಂಜ್ ಇದ್ದರೆ ಇಸ್ ದರ್ ಎನಿ ಪ್ರಾಬ್ಲಮ್ ಇನ್ ದ ಥ್ರೋಟ್ ಅಂತ ಒಂದ್ಸಲ ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಕೊಳ್ಳಿ. Okay, and another thing is you should have some vocal hygiene tips. You are already having frequent water intake, that's a very good habit. ಮತ್ತೆ ಮಧ್ಯ ರೆಸ್ಟ್ ಕೊಡಿ. 1 hour ಕಂಟಿನ್ಯೂಸ್ ರೆಸ್ಟ್ ಅಂತಲ್ಲ, ಈಗ ನಿಮಗೆ ಕ್ಲಾಸ್ ಆದಮೇಲೆ ಒಂದು 10 ನಿಮಿಷ ಮಧ್ಯ ಬ್ರೇಕ್ ಕೊಡಿ, ಆ ಥರ ಇದು ಮಾಡಿ. ಬಿಕಾಸ್ ಐ ಥಿಂಕ್ ಯು ಹ್ಯಾವ್ ಆಲ್ರೆಡಿ ಗಾಟ್ ದ್ಯಾಟ್ ಸ್ಲೈಟ್ ಚೇಂಜ್ ಇನ್ ಯುವರ್ ವಾಯ್ಸ್, ಸೊ ಯು ಶುಡ್ ಬಿ ಎಕ್ಸ್ಟ್ರಾ ಪ್ರಿಕಾಷನ್ಸ್ ತಗೋಬೇಕಾಗುತ್ತೆ, ಗೊತ್ತಾಯ್ತಲ್ಲ. ಆ್ಯಂಡ್ ಅನದರ್ ಥಿಂಗ್ ಇಸ್ ವಾಟ್ ಐ ಮೆನ್ಷನ್ ಆಲ್ರೆಡಿ, ಒಂದು ಡಾಕ್ಟ್ರಿಗೆ ತೋರಿಸ್ಕೊಳ್ಳಿ ಇನ್ನೂ ಫರ್ದರ್ ಇದಾಗ್ದಲೆ. ಮತ್ತು ಆ್ಯಂಡ್ ತುಂಬ ಜೋರಾಗೆಲ್ಲ ಮಾತಾಡಲ್ಲ ಅಲ್ವಾ ನೀವು ಕ್ಲಾಸ್ ತಗೊಳ್ಳುವಾಗ? ಪೇನ್ ಇದ್ದರೆ ಡೆಫಿನೆಟ್ಲಿ ದೇರ್ ಶುಡ್ ಬಿ ಸಮ್ ಇನ್ಫೆಕ್ಷನ್, ಸೊ ಯು ನೀಡ್ ಟು ಕನ್ಸಲ್ಟ್ ಮೆಡಿಕಲ್ ಡಾಕ್ಟರ್ನೇ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ತೋರಿಸ್ಕೊಳ್ಳಿ. ಪೇನ್ ಇದ್ದರೆ ಯು ಪ್ಲೀಸ್ ಕನ್ಸಲ್ಟ್ ಇಮಿಡಿಯೇಟ್ಲಿ. ಓಕೆ. And as I said earlier, since you are a professional voice user, you should be extremely careful in using your voice. You should never abuse it. Okay? Give frequent rest, all this water intake, and even some spicy foods atrala consume madkobedi. And class madhya you can ask the question to the students and take some break in between. Voice matadale ondu ಸ್ವಲ್ಪ madhya rest kodi. Okay, you ask the students for a discussion. You design your strategy of the class so that you don't have to speak out continuously. Okay, and definitely consult the doctor immediately. Okay, then all the best. Bye.
Okay, thank you. So you were explaining about the
Causes of hearing loss. So I told you that there are 3 categories under which we can classify these causes. One is genetic, other one is acquired, other one is sporadic. Example of genetic, of course, we see this in a lot of South Indian families. I think, we see that people get married within the relatives. I don't say that, it definitely causes communication disorders, but it increases the probability of the children having or expressing the genetic mutations, if there are any, and that leading to some kind of communication disorders. So what happens is, it could happen that all of us have genetic mutations, but they are not expressed. But if people marry from the same family, both the parents are likely to have the same mutated genes. So the chances of it getting expressed becomes more. That is one category. Acquired, of course, also you know that there could be multiple kind of infections due to which it can cause damage to the sensory cells of the inner ear, and that can lead to permanent hearing loss. Some of the drugs that is given for lung infections, we are in the corona times now, and lung infections are very frequently heard of. So in these conditions, the medicines that are given are they are all life-saving drugs, and sometimes, depending upon the dosage, they can actually lead to ototoxicity. That means to say, it can lead to damage to the sensory cells of the inner ear. That is another cause. People who work in factories could have exposure to very high levels of noise, and that can lead to noise-induced hearing loss. There are so many other age-related hearing loss. Like we see that a lot of people beyond 50 years and 60 years, they do develop hearing loss, primarily because there would be, like all parts of the body, ear also deteriorates with aging. It could be mechanical stress, or it could be deterioration in the general health that acts like predisposing factors, but we do see age-related hearing loss. Like that, we have a lot of ear infection is another cause. So these are acquired causes. Then you also have sporadic causes. So there are 3 categories.
Okay. Thank you, doctor. You were mentioning about secondary and tertiary prevention over the phone call, but can you just elaborate that? What is actually the secondary and tertiary prevention?
See, basically, primary prevention is like, you do something to ensure that the condition doesn't occur at all. Okay? That is possible, of course, Madam was talking about vaccination, Madam was talking about
Excuse
public
me, sir.
education.
Hello. Good afternoon.
Good afternoon, sir.
Yeah, good afternoon. Tell me, please.
My sister has twins, and one of them, they have hearing problems. So when we got tested, it turned out that only one of them has hearing problems. But now I think that they're able to hear well. Do you think I should come back for testing? It's been about years now, I think. Yeah.
Okay, I will hand over the phone to our expert. We have Dr. Sandeep M. Sir, can you please answer?
Madam, can you hear me clearly?
Yes.
Okay, so how did you suspect that one of the babies have hearing loss?
So please come down to get tested. So that's when we found out that.
Was it tested in the hospital?
Yes, sir.
Okay, so I think what they have done is newborn hearing screening. Is it at Mysore?
No, sir, it was in Hyderabad.
Hyderabad. Okay. So what happens is we audiologists actually do newborn hearing screening, wherein we do few audiological tests to screen out for hearing loss, and probably that's when they would have suspected that one of the babies may have hearing loss.
Okay.
You should go for a diagnostic audiological evaluation. It is mandatory. It's not a choice. It is mandatory. So once suspected in the screening test, it's mandatory that those babies go for detailed audiological evaluation. And you should not. You should be very careful because you said that it's already 1 year. This is the developmental period of the child. This is when the baby is actually listening to you and developing speech and all that. And the problem with hearing loss is it's not like blindness, it's not like orthopedic problem where you are evidently seeing the disability. Hearing loss is a hidden disability, therefore you may not even realize unless tested. So I recommend that you go for detailed audiological evaluation wherever the facility is there close by, or else you're welcome, you can always come to All India Institute of Speech and Hearing, our institute, and we have best of the facilities to do the detailed audiological evaluation. If the baby does not have hearing loss, it's great, we'll be very happy. But if the baby has hearing loss, then it needs immediate treatment with absolutely no delay.
Okay.
Yeah, please take the necessary steps.
Yes, sir. Yes. Thank you very much.
Thanks for calling.
Thank you. So you can continue with the secondary and tertiary prevention.
I forgot the question. Okay, we were talking about secondary and tertiary prevention. Okay, so suppose I was quoting WHO. I told you that about 60% of the causes of hearing loss are preventable at the primary level. Suppose they are not preventable, then let me concentrate on the younger group because otherwise it becomes too extensive to cover in this 1 hour program. Suppose let's imagine infants. We did all the things, that is we did good public education programs, and we have created good awareness in the population, and madam talked about vaccines, and so pregnant women are given a few vaccinations, and let's imagine as per the schedule they have taken all the vaccinations, they have taken very good nutrition, they have done everything. Still it's not impossible to get hearing loss in an infant. Okay, so in those cases actually we go for secondary prevention, where we need to detect hearing loss right at birth. This is where the newborn hearing screening, which the previous call also talked about, this is where newborn hearing screening comes into picture. So basically what we do is we have few screening audiological tests. One of the tests that is most frequently used and also recommended by Joint Committee for Infant Hearing, which is a worldwide accepted committee, okay, for infant hearing. is autoacoustic emissions. It's a test called autoacoustic emissions. It takes less than 1 minute to do that test, and we do ear wise. So we can test right ear and left ear separately, and through that test we can screen whether the baby is likely to have hearing loss or not likely to have hearing loss. One thing that I want to stress is screening tests are not confirmatory. They only tell you the probability. So whichever baby has not passed the screening test, in whom we did not get autoacoustic emissions present, we refer such babies for detailed audiological tests. Of course, there is one more step to it. There's another test called automated auditory brainstem responses in babies with high risk factors to have hearing loss. For example, hyperbilirubinemia is one of the high risk factors. Congenital rubella is another high risk factor. Like that, there are craniofacial abnormalities, another risk factor. Like that, if the infant is born with high risk factors, then we actually go one more step and do something called as automated ABRs. And in these two tests, if we get to suspect that the baby may have hearing loss, then what we do is we go for detailed audiological evaluation. We recommend detailed audiological evaluation. There are definite timelines for this. JCIH recommends 1 month, 2 months, and 3 months as the timelines. That means to say every baby should be screened for hearing loss within 1 month without fail. Okay, we have to screen. And those babies in whom we have suspected hearing loss to be present based on the screening test need to complete the detailed audiological evaluation within 2 months of the birth.
Excuse me.
Yep.
Hello? Hello, can you hear me? ನಮಸ್ಕಾರ ಹೇಳಿ. ಹೇಳಿ, ಕನ್ನಡ ನಮಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಹೇಳಿ ಸರ್.
ಸರ್, ನಮ್ಮಪ್ಪ ಅವರು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗೋದು, ಅವ್ರು ಮಾತು ಸ್ವಲ್ಪ ತೊಂದರೆ ಸರ್, ಏನ್ ಮಾಡೋದು ಸರ್?
ಓಕೆ, ನಮ್ದು ಎಕ್ಸ್ಪರ್ಟ್ ಪ್ರೊಫೆಸರ್ ಶ್ರೀದೇವಿ ಅವರು ನಿಮಗೆ ಡೀಟೇಲ್ಸ್ ಆಗಿ ಹೇಳ್ಕೊಡ್ತಾರೆ ಇದ್ರದ್ದು. ಮ್ಯಾಮ್ ಕ್ಯಾನ್ ಯು ಪ್ಲೀಸ್?
ನಮಸ್ಕಾರ. ಏನು ಹೇಳಿದ್ರಿ? ನಿಮ್ಮ ತಂದೆಗೆ ತೊದಲು ಥರ ಬರ್ತಾ ಇದೆಯಾ ಮಾತು? ಯಾವಾಗಿಂದ? ಹೌದಾ? ಓಕೆ. ಅವ್ರಿಗೀಗ ಎಷ್ಟು ವರ್ಷ? ಓಕೆ. ಅವ್ರಿಗೆ ಆ ಥರ ಮಾತು ಶುರು ಆಗಕ್ಕೆ ಮುಂಚೆ ಏನಾದರೂ ಕಾಯಿಲೆ ಇತ್ತಾ? ಏನಾದರೂ ಡಾಕ್ಟ್ರ್ ಹತ್ರ ಹೋದಾಗ? ಓಹೋ, ತಲೆಗೆ ಏಟ್ ಬಿದ್ದಿತ್ತಾ? ಹೇಗೆ ಅವ್ರು ಬಿದ್ರಾ? ಏನಾದ್ರು ಗಾಡೀಲಿ ಹೋಗ್ತಾ ಬಿದ್ರಾ? ಓಕೆ. ಸೊ ಓಕೆ. ಸೊ ಓಕೆ, ಗೊತ್ತಾಯ್ತು ಅವ್ರಿಗೆ. ಅದೇ ಮೆದ್ಲುಗ್ ಪೆಟ್ಟು ಬಿದ್ದರೆ ಖಂಡಿತ ಈ ಥರ ಮಾತು ಕೂಡ ಅಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಈಗ 3 ವರ್ಷ ಆಗಿದೆ ಅಂತ ಹೇಳ್ತಿದ್ದೀರಲ್ಲ, ಸೊ ಇದುವರೆಗೂ ಬೇರೆ ಎಲ್ಲೂ ಇದ್ರ ಬಗ್ಗೆ ತೋರಿಸ್ಲಿಲ್ವಾ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರ? ಹಾಂ, ಆದರೆ ಮಾತು ಮಾತ್ರ ಅಫೆಕ್ಟ್ ಆಗಿದೆ. ಆಯ್ತು. ನೀವು ಯಾವ ಊರಿಂದ ಕರೆ ಮಾಡ್ತಾ ಇರೋದು? ಓ, ಕೋಲಾರ ಅಂದರೆ ನಿಮಗೆ ಬೆಂಗಳೂರು ಹತ್ರ ಆಗುತ್ತಲ್ವಾ? ಕೋಲಾರದ ನಮ್ಮ ಸೆಂಟರ್ ಇದೆಯಲ್ಲ, ಹಾಂ. ಅಲ್ಲಿ ನಮ್ಮ ಇದು ಒಂದು ಎಕ್ಸ್ಟೆನ್ಷನ್ ಸೆಂಟರೇ ಇದೆ, ದೇವರಾಜರ್ಸ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಇದೆಯಲ್ಲ ಕೋಲಾರದಲ್ಲಿ. ಅಲ್ಲಿ ನಮ್ಮದು ಇದೇ ರೀತಿ ನಮ್ಮ ಸ್ಪೀಚ್ ಆ್ಯಂಡ್ ಹಿಯರಿಂಗ್ ಸೆಂಟರ್ ಕೂಡ ಇದೆ ಅಲ್ಲಿ ದಯವಿಟ್ಟು ಆದಷ್ಟು ಬೇಗ ಹೋಗಿ. ಯಾಕೆಂದರೆ 3 ವರ್ಷ ಆಗಿದೆ ತಲೆಗೆ ಪೆಟ್ಟು ಬಿದ್ದು. ಈ ಥರ ಕಂಡೀಷನ್ಸ್ ಎಲ್ಲ ಆದಷ್ಟು ಬೇಗ ತೋರಿಸಿ ನಾವು ತರಬೇತಿ ತಗೊಳ್ಬೇಕು. ಅದರಿಂದ ಖಂಡಿತ ಇಂಪ್ರೂವ್ ಮಾಡ್ಬೋದು. ಅವ್ರನ್ನ ಟೆಸ್ಟ್ ಮಾಡಿ ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಅವ್ರದ್ದು ತಲೆಗೆ ಪೆಟ್ಟಾಗಿದೆ, ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ ಅಂತ ತಿಳ್ಕೊಬೇಕಲ್ವಾ? ಇಲ್ದಲೆ ಅದು ನೋಡ್ದಲೆ ನಾವು ಹೇಳೋಕ್ಕಾಗೋದಿಲ್ಲ. ಅವ್ರನ್ನೂ ಕೂಡ ಪರೀಕ್ಷೆ ಮಾಡಬೇಕು, ಗೊತ್ತಾಯ್ತಲ್ಲ? ಸೊ ಆದರೆ ಕೋಲಾರದಲ್ಲೇ ಈಗ ನಿಮಗೆ ಸೌಲಭ್ಯ ಇರೋದ್ರಿಂದ ದಯವಿಟ್ಟು ಆ ಸೆಂಟ್ರಿಗೆ ಹೋಗಿ ಆದಷ್ಟು ಬೇಗ ತೋರಿಸ್ಕೊಳ್ಳಿ. ಏನು ಹೇಳಿ? ಅಲ್ಲಿ ಅವ್ರ ಹೆಸರೇನು? ರೋಹಿತ್ ಅಂತಿದಲ್ಲ, ಅವರು ಆಡಿಯಾಲಜಿಸ್ಟ್. ಲೋಕೇಶ್ ಅಂತಿದ್ದಾರೆ ಒಬ್ರು ಅನು ಅಂತ ಇದ್ದಾರೆ, ನಮ್ಮಿಂದಾನೇ ಇಲ್ಲಿ ಪಾಸ್ ಇಲ್ಲಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ಆಗಿದ್ದಾರೋ ಅಲ್ಲಿ ಹೋಗಿ ಕೆಲಸದಲ್ಲಿದ್ದಾರೆ ಅವರು, ಗೊತ್ತಾಯ್ತಲ್ಲ. ಸೊ ಅವರು ಲೋಕೇಶ್ ಅಂತ ಅವರು ಇದ್ದಾರೆ, ಅವರು ಇದ್ರ ಬಗ್ಗೆನೇ ಸಂಶೋಧನೆ ಕೂಡ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಸೊ ದಯವಿಟ್ಟು ಅಲ್ಲೋಗಿ ಭೇಟಿಯಾಗಿ ನಿಧಾನ ಮಾಡಬಾರ್ದು. ಇವತ್ತು ನೋಡಿ, ಇವತ್ತು ನೀವು ಶುಕ್ರವಾರ ಇವತ್ತು ಕಾಲ್ ಮಾಡಿದ್ದೀರಾ, ಬರೋ ವಾರನೇ ಖಂಡಿತ ಕರ್ಕೊಂಡು ಹೋಗ್ಬೇಕು. ನಿಧಾನ ಮಾಡಿದಷ್ಟು ಮಾತನ್ನ ಮತ್ತೆ ಸರಿಪಡಿಸೋದು ಕಷ್ಟ ಆಗುತ್ತೆ, ಅದನ್ನ ಚೂರು ಗಮನದಲ್ಲಿ ಇಟ್ಕೊಳ್ಳಿ. ಬರೋ ವಾರನೇ ಕರ್ಕೊಂಡು ಹೋಗ್ಬೇಕು ಖಂಡಿತ. ನಿಮ್ಗೆ ಅವ್ರನ್ನ ಮಾತನ್ನ ಇಂಪ್ರೂವ್ ಮಾಡಕ್ ಖಂಡಿತ ಆಗುತ್ತೆ. ಕರ್ಕೊಂಡು ಹೋಗಿ. ಸರಿ ಸರಿ,
ಥ್ಯಾಂಕ್ ಯು. Doctor, you were mentioning about newborn hearing screening. Can I ask?
So I was talking about 1, 2, 3 mantra, where we should be completing hearing screening within 1 month of the infant's birth, and within 2 months, if the baby is suspected to have hearing loss in the screening test, within 2 months we should go for diagnostic audiological evaluation, and if the baby is confirmed to have hearing loss in the diagnostic evaluation, then the rehabilitation should start without any delay much before 3 months of the baby's birth. So that we call it as 1, 2, 3 mantra, and that is what. So if we follow this 1, 2, 3 mantra, if we chant, then we will definitely be successful in rehabilitating every child with hearing loss successfully. So they become completely independent. They develop normal speech and language. Their academic performance will be normal. Everything is going to be completely normal. The child is going to develop as a completely independent individual.
Okay. Doctor, I want to ask whether this newborn hearing screening program, do you have at All India Institute of Speech and Hearing?
Yes. I mean, we are a premier institute in the country. So we have always taken the lead role when it comes to communication disorders. We have always taken the lead role in the country. Similarly, newborn hearing screening was started way back in 2008 in the institute.
Excuse me. Hello. Hello.
Hello.
Tell me.
നമസ്കാരം സർ.
നമസ്കാരം.
സർ, ഞാൻ കേരളത്തിൽ നിന്ന് സംസാരിക്കുന്നു.
ഓക്കെ, പറഞ്ഞോളൂ.
ഓക്കെ സാർ, ഈ പ്രായമായവർക്ക് കേൾക്കുമ്പോൾ ഉണ്ടാകാൻ ചാൻസ് വല്ലതും ഉണ്ടോ സാർ?
ഓക്കെ, അതിൻ്റെ ആൻസർ ഡോക്ടർ സന്ദീപ് അവർ പറയുന്നതായിരിക്കും. ഞാനത് വേണമെങ്കിൽ ട്രാൻസ്ലേറ്റ് ചെയ്യാം. Sorry. No, whether the hearing loss can occur at an older age. You were explaining about presbycusis. പ്രായമായവരിൽ കേൾവിക്കുറവ് ഉണ്ടാവുമോ ചോദിച്ചതല്ലേ? അതെ. They just want to know presbycusis. So you can tell in English, I can translate.
Okay, so it's not necessary that every infant, every person has got hearing loss with aging, but generally after 50 years, one can develop hearing loss due to aging. So basically, sensory cells in the cochlea, inner ear, are damaged, and that's why there would be gradual deterioration of the hearing loss. And usually, if it happens like that, it would be bilateral in nature. It will be same in both ears. And so, what I would advise is, after 50 years, it's better that one goes for a regular checkup with an audiologist to check whether they have developed hearing loss or whether they are developing hearing loss. And I must say that we even have tests which can tell you the risk of developing hearing loss much before hearing loss is damaged.
Okay. സാർ എന്താ പറഞ്ഞതെന്ന് പറഞ്ഞാൽ, പ്രായമായിട്ടുള്ള ആൾക്കാരിൽ കേൾവിക്കുറവ് വരാം. യൂഷ്വലി 50 വയസ്സിൻ്റെ മേലെയുള്ള ആൾക്കാർക്കൊക്കെ ഹിയറിംഗ് ലോസ് സ്റ്റാർട്ട് ചെയ്യാൻ സാധ്യതയുണ്ട്. പിന്നെ അപ്പോൾ 50 വയസ്സിന് മേലെയുള്ള ആൾക്കാർക്ക് ടെസ്റ്റ് ചെയ്താലേ നമുക്ക് പറയാൻ പറ്റുള്ളൂ. അതായത് എല്ലാവർക്കും ഹിയറിംഗ് ലോസ് വരണമെന്നില്ല. ആർക്കാണ് കൂടുതൽ റിസ്ക് ഫാക്ടർ ഉള്ളത്, അവരവരുടെ എന്താ പറയുക ജോലി അനുസരിച്ച് റിസ്ക് ഫാക്ടറിനൊക്കെ അസോസിയേറ്റ് ചെയ്തിട്ട് ചില ആൾക്കാരിൽ കേൾവിക്കുറവ് വരാം, എല്ലാവരിലും വരണമെന്നില്ല. പക്ഷേ ചില ടെസ്റ്റുകൾ ചെയ്ത് കഴിഞ്ഞാൽ നമുക്ക് നേരത്തെ തന്നെ കണ്ടുപിടിക്കാൻ പറ്റും ഹിയറിംഗ് ലോസ് ഡെവലപ്പ് ചെയ്യുന്നുണ്ടോ ഇല്ലയോ എന്ന്. അപ്പോൾ നിങ്ങളുടെ പറഞ്ഞ പ്രായത്തിൽ അവർക്ക് ഹിയറിംഗ് ലോസ്, അതായത് നിങ്ങൾ അവരോട് സംസാരിക്കുമ്പോൾ അവർക്ക് കേൾക്കാൻ ബുദ്ധിമുട്ടുണ്ടെങ്കിൽ ടെസ്റ്റ് ചെയ്ത് നോക്കിയാൽ നമുക്ക് മനസ്സിലാവും. ഓക്കെ. What they are asking is, usage of phone will increase the risk factor of hearing loss. and whether she will also get the hearing loss at a later age because her mother is having. Okay, sir explain ചെയ്തതിനു ശേഷം ഞാൻ അത് ട്രാൻസ്ലേറ്റ് ചെയ്തിട്ട് പറയാം. Okay.
There could be genetic predisposition. We can't deny that. But it's not necessary that if her mother has hearing loss, then she also has to develop hearing loss. Because, she might have carried those genes from her father, who doesn't have a hearing loss. So it's not necessary, but it's not impossible that she has genetic predisposition. That's one thing. I forgot the
other
second.
question was
telephone.
using
phone.
Will it-
See, anything too much is not good. Same thing holds good for phone. So if you limit your exposure, then it's obviously not going to get affected. But you speak for 8 hours, 10 hours, then definitely it can kind of weaken the sensory sense.
ഓക്കെ, അപ്പോൾ സാർ എന്താ പറഞ്ഞതെന്ന് പറഞ്ഞാൽ ജനറ്റിക് കാരണങ്ങൾ കൊണ്ട് കേൾവിക്കുറവ് വരാം. അപ്പോൾ അമ്മയ്ക്ക് വന്നത് കൊണ്ട് നിങ്ങൾക്ക് എന്തായാലും വരണമെന്നില്ല. കാരണം ഒരാളുടെ ജീന് നമ്മുടെ 2 പാരൻസിൻ്റെ അടുത്ത് നിന്ന് വരുന്നതാണ്, അമ്മയുടെ അച്ഛൻ്റെ. അപ്പോൾ അമ്മയ്ക്ക് ഇട്ടിരിക്കുന്ന ജീന് അവർ ചിലപ്പോൾ ഗ്രാൻഡ് പാരൻസ് ആയിരിക്കാം. നിങ്ങൾക്ക് ആ ഹിയറിംഗ് റിലേറ്റഡ് ആയിട്ടുള്ള ജീന് ചിലപ്പോൾ ഫാദർ എന്നായിരിക്കും വന്നിട്ടുണ്ടാകും. അപ്പോൾ എന്തായാലും വരണമെന്നില്ല, ബട്ട് ചാൻസസ് ഉണ്ട്. പിന്നെ ഓൾഡ് ഏജിലുള്ള കേൾവിക്കുറവ് ജനറ്റിക് റിലേറ്റഡ് അല്ല. പിന്നെ ഫോൺ യൂസ് ചെയ്യുന്നത്, വെറുതെ ഫോൺ യൂസ് ചെയ്യുന്നത് കൊണ്ട് കേൾവിക്കുറവ് വരണമെന്നില്ല. പക്ഷെ ഒരുപാട് സമയം, അതായത് മോർ ദാൻ 8 hours കണ്ടിന്യൂസ് ആയി, അതായത് കൂടുതൽ ശബ്ദത്തിൽ കേൾക്കുന്നതൊക്കെ കേൾവിക്കുറവിന് കാരണമാകും. അപ്പോൾ നോർമൽ രീതിയിലുള്ള ഫോൺ യൂസേജ് ഒന്നും കേൾവിക്കുറവിന് നിങ്ങൾ അതെ നിങ്ങൾ എവിടെയാണുള്ളത്? നാട്ടില് കേരളത്തിൽ എവിടെയാണ്? കൊല്ലത്തൊക്കെ അവിടെ ക്ലിനിക്കുകളും അല്ലെങ്കിൽ അവിടുത്തെ മെഡിക്കൽ കോളേജിലൊക്കെ ഫെസിലിറ്റീസ് ഉണ്ടാവും. അപ്പം നിങ്ങൾ അവിടെ പോയിട്ട് നിങ്ങളുടെ അമ്മയുടെ ഒന്ന് ചെവി ടെസ്റ്റ് ചെയ്യുന്നത് നല്ലതായിരിക്കും. ടെസ്റ്റ് ചെയ്ത് കഴിഞ്ഞാൽ പറയാൻ പറ്റും. കേൾവിക്കുറവ് ഉണ്ടെങ്കിൽ അതിൻ്റെ ട്രീറ്റ്മെൻറ്റ് അവർ പറയുന്നതായിരിക്കും, ഓഡിയോളജിസ്റ്റ്. കേട്ടോ? ഓക്കെ, ക്ലിയർ ആണല്ലോ അല്ലേ? പറഞ്ഞത് വ്യക്തമായിട്ടുണ്ടല്ലോ അല്ലേ? ഓക്കെ ഓക്കെ, ഫൈൻ, താങ്ക് യു. I think it is time to conclude our program. Now we have reached the end of our live phone-in program. My sincere gratitude to the resource person of today's program, Professor N. Sridevi and Dr. Sandeep M, for their enlightening talk regarding the communication disorder and its prevention. Now we understood that communication disorders are preventable, and the role of audiologists, speech language pathologists, and other multidisciplinary professionals in successful management of this condition. My sincere request to all our viewers is that please share the information what we have discussed all this time, and just make sure that if there is any communication disorder, get the treatment at the earliest. Thank you one and all. Have a great day ahead.
Thank you.